Any test for checking the stage of osteoporosis?
Yes, sir. There are certain bone mineral density tests called as BMD, where we can find osteoporotic, or whether you are osteoporotic, whether you are osteopenia, or whether you are osteoarthritic. We can have these tests done.
For someone who's in menopause and having symptoms of generalized joint issues of hip and legs, what would you suggest?
Yeah, so you may have to check into your estrogen level, and some simple therapies of oil applications can definitely help. If you are more into the osteoporotic changes, you need to intervene with the treatment. But if you are nearing, like maybe if you are just between 43, 42 and all, you can always take single herbs like ashwagandha churnam, shatavari gulam, shatavari powder also, which can tackle both your menopausal, premenopausal, and also equally help in preventing the bone deterioration.
There's a question from Mr. Kabir Karpir. Please guide for people who have high pitta and most of the herbs mentioned here are pitta increasing or heat generating of the body.
Yeah, it's like based on the body constitution, sir. If pitta is more, there are certain herbs like shatavari, aloe vera, which can balance both the pitta plus the bone health also. Like if you take a castor, if you take til, that is sesame seed, that is more like vata subsiding. But where shatavari, these things are not more, we need to see your prakriti, that is your body constitution, before we intervene with the single herbs.
Okay. Ma'am, there's a question from Ms. Tanvi again. I think this is relevant to the potli that you mentioned. So in that method, can you use only one type of leaf at a time
No, it's a
in the
mixture
pot?
of leaf. We can have,
Okay.
yeah, it's a mixture. We have, I just can mention few in Sanskrit. We have that is arka leaf. That is for Ganapati. We used to offer the tiny violet color flower. No,
Hmm.
that thick leaf of that. We can use lemon. We can use tamarind. We can use that karunachi leaf, castor leaves, and all. It's a mixture of. It's not a single one. But if these are not available, you can even use a single herb also. For an immediate effect, you can use different varieties. But if you are not accessible for all kinds, you can use one or two. Tamarind leaf is a very common one. You can use it. Lemon is easily available. So those kinds you can use.
Thank you, ma'am. Also, she's asked what kind of
Yeah,
sand is
addressing
used.
to your sand is preferably the one which, not the clay, the thicker one, which it has to be very loose sand like that.
Thank you, ma'am. I'm going to unmute Mr. Shmuel.
Okay, thank you very much. A very interesting lecture, a very interesting presentation. And I want to ask you how Ayurvedic wisdom can support reduction risk of cognitive diseases or dementia.
Yes, dementia. And you want to know about how Ayurveda deals with the cognitive related disorders for neuro health, right?
Yeah.
Yeah, there are many mentions, there are many treatments called Shirodhara, certain treatments and all, sir. But again, as I told you earlier, it is like a progressive disorder. We can prevent one, especially Alzheimer's, dementia, Parkinson's, early dementia, schizophrenia, and all. There are many treatments related to that. In that, very commonly used is called Shirodhara, where we let a stream of oil flow to your forehead. You may have to stay as an inpatient for minimal 3 weeks, where again we can prevent the further deteriorations only.
Thank you very much.
Thank you,
Thank you.
Shmuel.
Welcome, sir.
Ma'am, there's another question from Ms. Kambi. Any tests for checking the stage of osteoporosis?
Yes, sir. There are certain bone mineral density tests called as BMD. For higher risk of like osteoarthritis, rheumatoid arthritis and all, there are different blood works done. But there is a very basic test called bone mineral density test where we can find osteoporotic or whether you are osteoporotic, whether you are osteopenia or whether you are osteoarthritic. We can have these tests done. And of course, the blood test where we see vitamin D and calcium, vitamin B12, that can be something which we can make it as a marker to see whether you are low in calcium like that.
Thank you again, ma'am.
Addressing her question, PCOD, is that connected with the bone health? PCOD is again a syndrome. Like you see, most of the PCOD patients, their primary symptom would be obesity. So again, with the obesity, your knee joints and ankles may get weaker because they are the weight bearing joints of your body. So it is not directly connected, but yes, when you are in a menopausal, it could be related to your menopausal age, but not a PCOD. Like once again, PCOD is a disease where we get with your sedentary life habits. Osteoporotic is also one of the main causes where the sedentary life habit is trigger. So relating to the causative agent of both the disease, it is connected. But once if you have PCOD, your doctors would advise to reduce your weight. So losing weight is again a boon for your knee joint health also. So that way it is connected.
Thank you so much, ma'am. For the next question, how to identify difference between RA and OA?
Both are different territories. Arthritis, again, only with the blood test. We have markers called rheumatoid factor, which is supposed to be lower than like 10, maximum 10 will be the biomarker. But rheumatoid arthritis, we get affected in every joint, and morning stiffness would be there, swelling would be there, feverish feeling would be there, bitter taste in the tongue would be there, and it affects each and every joint. But osteoarthritic, maximum the major joint, and to an advanced stage it would be like other joints, and we can easily make out the difference in the x-rays also. And RA factor is one of the criteria where we differentiate between both the three. That is done by the blood test one.
Thank you, ma'am. Ma'am, I wanted to ask a question from my end. So, if we use any one particular herb regularly onto our joints, or maybe say even ginger or anything for cold that we put on our nostrils or anything like that, so does our body develop a tolerance towards those particular herbs over a period of time?
Yes, sir. Even it's not only a single herb, it is any kind of medicine. Once if you are used to that, that is why we call it as like every like I don't know whether you believe being fasting in Ekadashi, and our tradition is like that. Once in every 15
Yeah.
days, our ancestors have made it as a fasting. Like in every Ekadashi, you fast without any food, or you take a minimal amount of food and all. So that is a natural way of detoxifying your
Detoxification.
impurities, what you have collected from the previous. Like that, there is a concept called Ritu Sandhi in Ayurveda. That is like when a seasonal transition is there. From summer, you are entering into the winter. That combining effect of that particular period would be there. No, that is where you need to take a body detox, either in a form of an oral cleansing or in the form of enema like that. So these are some natural way to detox the impurities. This is one of the main action what you can do to prevent your body getting accustomed to certain single herb. Like for example, as you asked, if you take turmeric on a daily basis, whether your body will get used to that or immune to that. Once when you are taking the periodical cleansing, the effect would be much more better. That is why our system is like that. You go into a fasting every 15 days. Even in other communities, like getting into this Ramjan fasting, they just take the minimal amount of the food. So that is that 30 days they are making the body a complete detox. In that, in other cultures also, we have Ekadashi, we have other, we name it under God's therapy, where people believe, and that is all. They have a scientific reason for every kind of practice what we follow from our ancestors. This is one way where your body naturally gets detoxified. Second, you can always prevent some single herb or something like that getting used or getting immune to your body like that.
Thank you so much. Very wonderfully answered.
Yeah.
For the next question, okay, for someone who's in menopause and having symptoms of generalized joint issues of hip and legs, what would you suggest?
Yeah, so you may have to check into your estrogen level, and some simple therapies of oil applications can definitely help. If you are more into the osteoporotic changes, you need to intervene with the treatment. But if you are nearing, like maybe if you are just between 43, 42 and all, you can always take single herbs like ashwagandha churnam, shatavari gulam, shatavari powder also, which can tackle both your menopausal, premenopausal, and also equally help in preventing the bone deterioration.
Thank you, ma'am. There's a question from Krishna Zoti. How does one identify the dosha?
Dosha, that is a huge challenge, sir. You are born with two doshas, that is called Prakriti. And when these doshas transfer from its own seed to others, that becomes Vikruti, that is the vitiated state. You need to have a proper practice if you want to identify the particular doshas, sir. There are certain common criterias. Maybe if Vishwa gives me a chance some other time, I can make a separate session how to analyze your dosha, how to analyze which dosha has aggravated, and what are some common things you can prevent for the seasonal regimen, and to bring back to your vitiated doshas like that. That's a very huge chapter which can't be dealt in like 5 minutes, 10 minutes time. We need at least 2, 3 sessions to understand the basic constitution of your body. What is the dosha, what has been aggravated, and how to bring it back like that.
Thank you, ma'am. There's a question from a guest. I'm having inflammatory arthritis like ankylosing spondylitis HLA-27 positive and cervical area is slowly getting fused and limiting the range of motion. Even I was following periodic Ayurvedic treatments, so allopathy. Doctor said enough with Ayurvedic treatments. We'll start biologics before it gets completely fused. But I'm afraid of side effects and want to continue with Ayurveda. So can we stop the progression and improve the cartilage between vertebrae and improve the range, or should I go for both?
So ankylosing spondylitis is again a genetic. When your HLA-B27 is positive, you carry the gene, and I wish you could have detected in the early stages. But yes, there are certain therapies which helps to improve your flexibility of the joint. But to reinstall the lost cartilage, I may not guarantee you or assure you, because that is quite difficult. But depends again on the age and your lifestyle. But even though you go in with any other allopathic medications, you can still continue with Ayurveda. There is no harm in continuing it with Ayurveda, because always the joint flexibility is intact with Ayurvedic treatment. But you need to have a proper doctor's advice, because in name of Ayurveda, many people does it in a very layman way. You need a proper vasti, that is cleansing therapy. I don't know whether you have undergone those vasti treatment and all, because ankylosing spondylitis is a very intense disease and very chronic disorder. In that, vasti is the best therapy you can follow every year, and you can repeat Ayurveda once in a year. Definitely there are no side effects with that. But in allopathy, I am not very sure. But my sincere suggestion would be do both the things simultaneously, and over a period when you feel better symptomatically, you can continue only with Ayurveda. It helps to improve your quality of the life actually.
A question from Mr. Manish T. Mehta. What is viral arthritis?
Yeah, viral arthritis is like like for example, if you don't treat your fever properly. For example, many people when they get infected with the fever, they just pop in a dolo or just a paracetamol and suppress the fever. But in Ayurveda, it is not like that. When fever is a reflection where your body rejects something outside. So the best medicine for the fever is fasting. That is why our previous, like our grandparents and all, just give only a light food like either kanji or rasam during your fever. You should let the body heal by itself. In Ayurveda, we say lankanam paramaushadam. That is, fasting is the best medicine, and in fever, you need to fast or feed yourself a very light food. But when you suppress the fever with some antibiotic or some antiviral medicines like paracetamol, dolo, zerodol, or whatever it may be, it keeps affecting your one of the metabolic system. It could be a joint, it could be an circulation, it could be your gynec or whatever it may be. Many people, those who have a chronic metabolic disorder, if you take a history of that, they would pretty surely take medicines for a longer timing. I think I have mentioned in my slides there, those who are on a long term medicines for diabetic, hypertension, cardiac ailments, blood thinners and all, they do have a tendency to develop osteoporotic changes also. This is also a kind of viral arthritis, is also a kind of joint related disorder where people have very regular habit of suppressing their some immunity related disorders on a very frequent basis. For example, small headache, they pop in a painkiller. Small stomach pain, they pop in a painkiller. Your body gets immune to certain kind of steroid painkillers and all, where you result in getting some metabolic disorder. This is also one of kind of a disorder like that.
Thank you, ma'am. Ma'am, a question from Dr. Kirti Gaur. Ma'am, is there any Ayurvedic treatment for migraine or headache?
Yes, sir. Plenty of medicines are there. Even as an outpatient, we have many diet changes, lifestyle changes, and all. And as an external therapy, we have some Shirodhara kind of treatment and some treatments called Shirovasti, where one-sided headache and chronic migraine can be easily tackled with.
There's a question from Mr. Sagare. Treatment for autoimmune diseases. What tests are required to find out autoimmune diseases?
It depends on the disease, sir. For example, this ankylosing, these kinds, under there are different types of tests related to that, purely based on what disease you are affected with, like that. There is no general test like that.
I think we've covered all of the questions from the chat box.
Thank you for your patience listening also. And as I told you, I'm always grateful to Shri Mahani ma'am. Always she gives me an opportunity to create this awareness with the public. And thank you again for your patience listening.